My project is entitled Current Point-of-Care Ultrasound Curricula among Canadian Internal Medicine Training Programs. Point-of-care ultrasound, or POCUS, is a growing field that's being increasingly used by internal medicine specialists for both diagnostic and therapeutic purposes. Despite this, internal medicine physicians and trainees have varying degrees of comfort and skill with POCUS, and many report the use of POCUS despite having any formal training. To address this, in 2017, the Canadian Internal Medicine Ultrasound Working Group, or CIMUS, provided guidance about POCUS training at both the core internal medicine residency and the GIM fellowship level. They recommended clinical applications and POCUS skills that should be taught to core trainees at the PGY 1 to 3 level and to GIM fellows at the PGY 4 to 5 level. The adoption of these recommendations has not been uniform. The purpose of this study is to assess the POCUS applications being taught to both core and fellowship level internal medicine trainees across Canada. In order to accomplish this, a survey was developed by the study authors to assess which POCUS applications were being taught to trainees across the country. An initial draft of the survey was developed by the primary author and distributed to all authors. All authors had an opportunity to provide input, and the survey questions were debated in an iterative process until consensus among all authors was achieved. The survey was subsequently distributed to program directors and POCUS leads for all internal medicine and GIM training programs in Canada in February 2022 via SurveyMonkey. Data collection and analysis was completed May 2022. These results were displayed graphically and compared qualitatively to the curricular recommendations made by CIMUS in 2017. The results are displayed graphically with bar graphs. The two columns of graphs in the middle of the poster represent diagnostic POCUS applications, with those being taught to core programs on the left column, those being taught to GIM fellowship programs on the right. Each row represents a different organ system. From top to bottom, there's cardiac, lung, abdominal, vascular, and skin or soft tissue POCUS. Each bar represents a specific diagnostic application within that organ system. The two columns of graphs on the right upper corner of this poster represent procedural applications. Similarly, core internal medicine is on the left and GIM fellowship is on the right. The top row represents indirect procedural applications using POCUS to landmark a space for needle insertion. The bottom two represent direct procedural applications, which use direct needle visualization and guidance using POCUS in real time during the procedure. Each bar represents the percentage of programs that are teaching a given application to trainees, with green bars being applications that are recommended for a given level of training, and red being those that were not recommended. As you can see, no application is being taught by 100% of the program across the country, even those recommended by CIMUS. Additionally, many applications not recommended by CIMUS are being taught to trainees. For example, not all core programs are teaching core trainees how to identify free fluid in the pleural space or peritoneal space, which are considered fairly basic POCUS skills. Meanwhile, several cardiac applications are being taught to core internal medicine trainees, despite this being a fairly advanced skill that's not recommended until the fellowship level. Overall, there's considerable variability among internal medicine and GIM fellowship training programs in terms of which POCUS applications are being taught. Few programs are teaching all of the CIMUS recommended applications, and many are teaching applications not currently recommended by CIMUS. We believe that national standardization of POCUS training in core internal medicine residency and GIM fellowship will help ensure all graduating internists meet a minimum competency and skill level with POCUS. Further research into how these applications are being taught is also being conducted by our group and will also help further inform curricular recommendations. Thank you.